It's a pleasure to be with you. The title of this talk is Management and Public Health Leadership, Managing Functions. There are no disclosures for this presentation. Objectives include review the 5 management functions of planning, organizing, staffing, directing, and controlling. Discuss the difference between goals and objectives. Discuss the attributes of SMART objectives and goals. Review the concept of integration and how this relates to effective management. Emphasize the importance of staffing. Discuss the importance of casting vision for adequate directing. Review formative, process, and outcome evaluation and how that relates to the functions of planning and controlling. Discuss the 7 steps of problem solving. Emphasize the importance of evaluation for effective problem solving, and review life orientations, appeals to change, and cultural aspects of decision making as they relate to management in cross-cultural situations. There are 5 main management functions: planning, organizing, staffing, directing, and controlling. The leader or manager in each of these functions needs to problem solve and make decisions. Almost everything a manager does falls into one or more of these functions. Managers must be adept at all 5 of these functions. A quote from the book Essentials of Management and Leadership in Public Health affirms that by stating, concentrating on a few of these functions to the exclusion or diminution of the others will invariably cause problems for the organization. This talk will focus on those 5 functions, plus problem solving and decision making. The general sequence of these functions is first planning, followed by organizing, staffing, directing, and controlling. Yet these functions are complementary. The relationships of the functions with each other are complex, so much so that it may not be clear at any one time which function the manager is applying. Let's first consider planning. Planning is deciding in advance what is to be done, and as previously mentioned, is usually, if not always, the first management function used. Managers at all levels plan, though the context, content, and focus of those plans vary greatly dependent on their management level in the organization. There are basically 2 planning situations. One de novo, or for example, planning for a new program, or 2, planning to correct an inadequate initiative or program. Planning also establishes goals and objectives. There is a difference between goals and objectives, though in practice the line of separation is commonly blurred. In many, if not most instances, the terms may be used interchangeably. Goals are defined as broader in scope and more long-term than objectives. How broad does an objective need to become a goal is difficult to define. The same is true with the threshold between short and long-term timing. So in this session, I will use these terms interchangeably. Objectives or goals should be SMART. SMART is an acronym where the S stands for specific. The goal needs to be clearly stated and should answer questions like who, where, what, and why. The M stands for measurable. What parameter will be used to determine if you have reached the objective or goal? This parameter will obviously inform the evaluation process. The A stands for achievable. Does this goal seem reasonable within available and accessible internal and external resources? The R stands for relevant. will this objective or goal help accomplish the mission of the group and organization? The T stands for time-bound. When will this objective or goal be accomplished, providing a realistic target and element of accountability? In addition to goals being SMART, an accountable individual also needs to be assigned to coordinate and assure the goal is achieved. Without that assignment, nothing happens. The next step is organizing. Organizing arranges resources to achieve objectives and goals defined in planning. Organizing results in an organizational design and commonly results in departmentation of the organization. A hierarchy is often established that ranges from individual positions to work groups, larger units, and eventually how this hierarchy works together to support the mission of the whole organization. Organizing and developing the organization's hierarchy includes the assignment of authority and responsibility to accomplish the goals and objectives. Effective processes and integration are key factors for success in this step of organizing. For public health, appropriate integration, both internally and externally, is essential to improve the health and wellness of the public. An Institute of Medicine report in 2012 focused on the need for increased true integration of public health and primary care to adequately address the goals of decreasing risky behaviors in the population. Even though this report focused on the integration of public health and primary care, the concept of increasing integration across other silos applies to the management function of organizing in general. In our current public health environment, appropriate integration both internally and externally is often necessary to meet an organization's goals and objectives. One of the most used diagrams from that 2012 IOM report is adapted on this slide. There is a continuum of integration from isolation to merger. In between those poles rest awareness, coordination, collaboration, and partnerships. Isolation means that groups have no idea what others are doing. Awareness means that groups are cognizant of others, working in common areas of interest, but have no engagement between groups. Coordination, collaboration, and partnerships are defined as increasing levels of working together. Also, as one moves from the left pole of isolation to merger, there is increasing dependence or interdependence of groups on each other. Merger is the state of total immersion and fusion. Isolation and merger are relatively uncommon. Most experts feel that much of what is done currently in integration falls into awareness and coordination with too little true collaboration and partnerships. The Institute of Medicine recommended that increased collaboration and partnerships are needed to meet true health and wellness goals in the future. Boundary spanning skills and competencies help public health effectively integrate across silos. Boundary spanning leadership skills are discussed in other sessions of the North Dakota Public Health Training Network. Staffing is extremely important. Most organizational costs fall into the area of staff pay and benefits. Finding, hiring, and retaining quality staff is extremely important for every organization, including public health. Staffing is a major responsibility of leaders and managers at all levels of an organization. Staffing tasks include acquiring, which includes establishing a system for recruiting, evaluation, and selection of candidates. It's important to select candidates that identify and support the beliefs and values of the organization, or problems will be inevitable. During the evaluation process, the values of the organization should be clearly stated and discussed, including any concerns the candidate has regarding those values. Training and maintaining is another task of staffing. Less than 15% of full-time public health workers have any formal training in public health. Providing staff training is important for public health organizations. The integration of public health and academic public health training programs can be extremely helpful to meet those needs. During the annual performance evaluation, training needs and opportunities to improve the employee's skills and competencies, a lifelong learning approach to training, should be discussed and planned. A learning management system to monitor and provide appropriate trainings is helpful. The North Dakota Public Health Training Network is developing practice-based curricula like this session to enhance public health workforce training. Retaining is another task of staffing and includes incentives, morale, advancement opportunities, etc. Staffing skills and competencies can be divided into technical and social. Technical skills and competency categories include staff planning, job task analysis, performance evaluations, and compensation and benefits. Social skills and competency categories include promotion and counseling. Counseling is a common issue with staff and often revolves around personal and interpersonal issues. Basic counseling skills are helpful for managers at all levels. Next is directing. Directing occurs when managers initiate and oversee plans to accomplish goals and objectives. Skills for appropriate directing include judgment on how and when to implement the plan. A manager must also be able to motivate and communicate with employees. The ability to motivate is linked to having a shared vision. As mentioned previously, a major role of senior leadership is to cast an inspiring and motivating vision. That's not a one-time event, but must be restated continually. To re-emphasize what Steve Farber said in his book, The Radical Leap, a vision statement doesn't generate energy. Love does. Great ideas do. Principles and values do. But vision from the heart is, by definition, an expression of love. And not only is that more energizing, it is energy. The vision needs to come from the heart. The leader must deeply believe in that vision. It needs to say, this is who I am. This is what I believe. This is what I think we can do together if we put our hearts into it. So the vision needs to be continually restated through words and the passion of the manager leader. The manager must become a living, breathing vision statement. That kind of vision statement is contagious. Employees will be affected. They will be inspired and will follow the leader manager. During this staffing function, as previously mentioned, careful recruiting and selection of employees who share the beliefs and values of the organization, the base for its vision, will also help immensely with vision alignment. The next function is controlling. Controlling is related to planning, since it evaluates what was planned and implemented and makes appropriate adjustments to the plan. Controlling monitors and evaluates process and outcomes utilizing a basic four-step process. 1. Set standards. 2. Measure the appropriate metrics. 3. Compare actual with expected results. And 4. Adjust to correct problems and deviations. These 4 steps are also known as a performance improvement process, which is essential for high-performing, effective public health programs. There are 3 main categories of tools for evaluating population-based programs: formative, process, and outcome. Formative evaluation provides information that helps plan a program. Process evaluation commonly assesses participation in activities that are assumed to result in the desired outcome. Outcome evaluation measures the actual desired end product. Formative evaluation would primarily relate to the planning function. Process and outcome evaluations would be part of the controlling function. Public health program outcomes are often delayed by decades. An example would be the outcome of a decrease in chronic obstructive pulmonary disease, COPD, due to tobacco control program interventions. This outcome will not be seen for decades. Therefore, process evaluations are often used as early measures or surrogates for final outcomes. Process evaluation for tobacco control could be measuring the number of individuals who completed a tobacco treatment program and remained tobacco-free for at least 6 months. Several studies have shown that individuals who consistently adhere to a healthy behavior for 6 months or more experience less recidivism or relapse. So the process evaluation would assume that these individuals would eventually be shown by later outcome evaluations to have less COPD. Both process and outcome evaluations are important. Process evaluations are commonly used as early measures to evaluate public health program efficacy. Colin Powell stated, "No battle plan survives engagement with the enemy. The best made plans of organizations will need adjustments." In my 35 plus years of public health practice, I've never managed a program that didn't experience problems and require changes. Sometimes the problems are technical, requiring minor adjustments that can be accomplished by the leader manager. But in other instances, the problems are adaptive, requiring a manager-facilitated group process to find an appropriate solution. According to Linsky and Heifetz in Leadership on the Line, the single most common source of leadership failure we've been able to identify in politics, community life, business, or the nonprofit sector is that people, especially those in positions of authority, treat adaptive challenges like technical problems. In other words, they try to manage their way out of situations that require group process. Understanding the difference between technical and adaptive skills and when to use them is critical for effective leaders of any organization. Further discussion of adaptive and technical leadership will be covered in other sessions of the North Dakota Public Health Training Network. Managers spend significant time solving problems and making decisions. Some problems are technical and can be solved by the manager leader, yet many problems are adaptive or complex, unstructured, non-routine, and even lie beyond the manager's direct control. As previously discussed, these adaptive problems require a group process to solve, sometimes internal to the organization, and at other times facilitating a group process, including external partners. The diagram lists the 7 basic steps to problem solving, including problem analysis, develop assumptions, identify alternate solutions, assess alternate solutions applying decision criteria, select the best solution, implement the solution, and evaluate the results. As diagrammed, this process is cyclical. Often the evaluation process identifies additional problems that need to be addressed. First, let's discuss problem analysis. Most problems a manager leader addresses are associated with deviation from what was expected. That could include deviations from desired organization or program objective process or outcome evaluations, or the less than expected individual performance of an employee, etc. There are 3 steps to problem analysis. 1, problem recognition. 2, problem definition. And 3, developing a problem statement. The first step is recognizing or identifying that a problem exists. That isn't easy in the midst of a busy schedule. I've known several managers, and I confess, including myself, that were like the frog in a pan of water on the stove as illustrated. He or she doesn't notice the slowly increasing heat or danger of a problem or situation until it is or is almost too late. Always considering and being alert to subtle messages sent from the surrounding environment that may indicate an emerging problem is an important skill for managers. There are 3 stages of problem recognition. The first stage is gestation or latency, which may present as those subtle cues indicating a problem. Great managers are able to identify problems and intervene at this stage before they blossom into full-blown crises. This ability to sense problems and interpret subtle cues comes from experience. Mentorships can help new manager leaders develop this skill. The second stage is categorization, where problems are obvious, though they often can't be clearly described. The third stage is diagnosis, which means that the manager did something, like gathering information that helps clarify a situation and define a problem. That information may include reviewing reports and data, interviews, observations, information from work groups, feedback from stakeholder groups, etc. Managers may often try to ignore a problem at these various stages, hoping it will just go away. It won't. Take my word for that. When you have an inkling or sense that a problem may exist, it most likely does. Do something. Investigate the issue. From my experience, when you begin to assess the situation by gathering information, you will often find that it's real and just the tip of the problem iceberg. The second stage of problem analysis is defining the problem. Some problems are easily identified and defined based on obvious, objective information. An example of this relates to clinical work I was involved with at Spirit Lake Nation several years ago. We were seeing a lot of children with asthma, more than in the past. A house-by-house survey identified a 21% prevalence of childhood asthma, 3 times the national average. The objective information was clear. These children had increased asthma. This resulted in the development of an asthma clinic to provide diagnostic and clinical care, including the development of asthma action plans for these kids. This program eventually included over 80% of the children with asthma at Spirit Lake. Other problems are subjective, with the problem description varying greatly from individual to individual based on their interpretation of the situation. An example of this being a personnel conflict we had in a program of the Department of Health several years ago. In assessing the issue, numerous perspectives of the problem and its root causes vary greatly across the spectrum of managers and employees in the program. This was very subjective and difficult to define. We gathered as many objective facts as possible and made a decision based on those facts, not rumors, hearsay, or assertions. Fortunately, the problem resolved. Emotions in subjective situations are often elevated. Remain objective. Gather the best facts you can and base your definition of the problem on facts, not emotions. Ending the problem definition stage too soon often results in poor solutions or even in solving the wrong problem. The third stage of problem analysis is developing a problem statement. Developing a problem statement takes what is learned in the problem definition stage and creates a brief description of the problem. The authors of the Essentials of Management and Leadership in Public Health state, developing a problem statement lies in the discipline of reducing thoughts to writing, providing the advantage of a written document in communicating to others who are working to solve the same problem. A problem statement should address the root cause, not just a symptom. If it only addresses symptoms, the root problem may persist and continue to impact the organization. The solution should be within appropriate lines of authority and resources of the solvers. It should be narrow enough to provide clear direction. Overly broad statements leave solvers without clear direction. It should provide positive goals, including limitations. It's wise to prepare more than one statement, since there are generally more than one way to state a problem. This takes patience and additional thought to prepare these iterations. In almost every section of a Department of Health, appropriately stating a problem is essential. Whether defining an outbreak in disease control, a personnel problem, communicating with legislative leadership, or working with stakeholders, etc. Being able to effectively define a problem in a written format is an important skill for a manager leader. John Dewey, an educator, emphasized the importance of good problem statements by writing, "A question well put is half answered." There are 4 parts of a good problem statement, including an invitational stem, along with ownership, action, and goal parts. So let's look at the problem statement on this slide. In what ways can disease control improve response times for customers inquiring about school immunization requirements? The invitational stem is, in what ways can? Ownership of the problem is addressed in the disease control program of the department. Action is improve. The goal or objective of the problem statement is response times for customers inquiring about school immunization requirements. This problem statement also meets the other criteria. It is brief, addresses the root cause of slow internal response times, is within the authority and resources of the program, is narrow enough to give clear direction to the solvers, and provides a positive goal. Another iteration of the problem statement could be, in what ways can disease control epidemiologists reorganize their time schedules to improve customer response times when inquiring about school immunization requirements? This would further narrow ownership to disease control epidemiologists and change the actions to reorganize and improve versus just improve. These and other iterations could be assessed when considering the best statement to address the problem. Let's consider how to find the root cause for just a few minutes. A CDC senior epidemiologist simplified the process to a series of sequential questions working down to an eventual root cause. Let's consider those questions for our example problem of disease control response times. The first question may have been, why are so many people in the state confused about school immunization requirements? The answer may be, because they don't have appropriate information. The next question could be, why don't they have appropriate information? The answers could include, there are barriers to getting immunization information from public health experts. The next question could be, what are those barriers to getting immunization information from public health experts? The answer could be, it takes too much time when people call the Department of Health to get someone to answer immunization questions. The next question could be, why does it take too much time when people call the Department of Health to get someone to answer immunization questions? The answer could be, immunization personnel are busy working on other epidemiologic projects. This sequence is continued until the root cause is identified. This is a practical and simple way to identify root causes. Let's consider what including limitations means in this list of criteria for a good problem statement. Let's consider the problem statement on this slide. In what ways can we solve the problem of excessive coffee breaks to maximize use of staff resources? This problem statement could be further improved by seeking the root cause for excessive coffee breaks. Could there be tension or conflicts within the organization? Could this be associated with poor job descriptions? Maybe leadership tried to find a definite root cause, but were left dealing with the symptom of coffee breaks for now. Sometimes a root cause can't be easily identified. The organization hinted at a cause related to morale issues by adding a limiting phrase to the problem statement, but without damaging staff morale. Limitations like this one, added to a problem statement, sets parameters for the solvers to further clarify direction. Another aspect of problem analysis is facts and reason. A fact is defined as a truth, a reality, an actuality. Some facts are easily verifiable, and others are subject to debate. Verifiable facts are highly reliable. Some facts are more important than others. Some facts are subject to judgment and interpretation. For example, a tape measure can measure a room's dimensions and is verifiable. Whether a room with those dimensions can hold 100 people for a meeting is debatable and subject to judgment. Other sources of information that managers can use in order of reliability includes circumstantial evidence based on deductive reasoning or inference, assertions or judgments of others that may be based on facts, hearsay, or rumors and hearsay. Give very little weight to assertions, rumors, and hearsay, though they may suggest potential problems that warrant investigation. Obtain verifiable facts. They should take precedence over all other types of information in the problem analysis function. The second step in problem solving and decision making is to develop assumptions. Assumptions use logic to extend what is known. Assumptions never supersede known facts. When facts are insufficient, manager leaders use deductive and inductive reasoning to make assumptions. Assumptions impact the choice and quality of a solution, including whether or not a problem is within a manager's or group's authority, whether additional resources are needed to solve a problem, if a problem is caused by an uncontrollable external factor, the relative importance of a problem, the risk a problem poses for the organization, the political and economic consequences of a problem, and the likelihood of success of a potential solution, etc. This slide defines deductive and inductive reasoning. Deductive reasoning uses facts obtained from several related events to generate an assumption. Deductive reasoning is commonly used in making sense of circumstantial evidence. An example of deductive reasoning would be finding several rooms that were half painted and therefore making an assumption that a painter's work was not yet done. Inductive reasoning uses facts from a single event to make an assumption or generalization. An example of inductive reasoning would be that a newly painted wall in a room leads to an assumption that there was a painter who painted the wall. So to restate, when facts are insufficient to make assumptions, deductive and inductive reasoning are commonly used to help generate assumptions. Manager-leader personal bias, usually based on previous experience, can significantly impact assumptions. These biases may have a positive or negative impact. Just realizing that all manager leaders have biases can help those manager leaders assess the potential impact of those biases and positively influence the quality of their assumptions. I would like to mention two major manager leader biases: anchoring and escalating commitment. Anchoring is choosing a starting point from past experiences and data and adjusting from that point based on new information. An example would be using a budget from the previous year as a base or starting point for the next year's budgeting process. That bias could be a good or bad starting point dependent on the quality of last year's budget. The escalating commitment bias relates to manager leaders maintaining and justifying the status quo of the organization, its current programs and strategies. As above, this bias could also be good or bad based on the quality of the status quo. There is a strong tendency for manager leaders to make assumptions that justify their past decisions, even if those decisions are obviously flawed. Manager leaders often feel that they need to be perfect, a perceived attribute of good leadership. So each decision they make must be correct. They can't admit that they made a mistake. The opposite is actually true. Weak and poor leadership relates to manager leaders who persist in justifying previously flawed decisions. Several years ago, I worked under a leader who made several poor decisions regarding the strategic direction of our medical program. I pointed out the negative impact this would have on the program and ultimately the health and wellness of people. He candidly said, "I realize that I made some wrong decisions regarding the program, but I unfortunately cannot change them, since that would not reflect well on my leadership status and the respect I need to lead this organization." He obviously lost sight of his primary role as a leader to make decisions that would positively impact people's lives versus his perceived status. Every leader will make poor decisions. Admitting mistakes, flexing, and adjusting is a sign of a great leader. After developing assumptions, it's time to identify and assess alternate solutions, steps 3 and 4 of the problem-solving decision-making cycle. There are essentially 3 practical steps to identify and assess alternate solutions, including 1. From the assumptions generated in step 2, additional information and data is collected, if necessary, to further clarify those assumptions, and tentative alternate solutions are generated. Step 2 is to apply general decision criteria to narrow the solution list. Step 3 is to utilize a decision matrix to help identify the best solution. Applying some general decision criteria helps to roughly triage and accept or reject alternate solutions before utilizing the more detailed use of a decision matrix. These criteria include: is an alternate solution on the list unethical or illegal? The ethics standard for the organization is closely linked to the organization's values, as previously discussed. Is an alternate solution inconsistent with the organization's vision, mission, or cultural values? Is an alternate solution unacceptable financially or politically? And last, is an alternate solution infeasible or not capable of being carried out or put into practice? A decision matrix like the one on this slide, adapted from John Arnold's work, analyzes in more detail the alternate solutions that passed the general decision criteria process. It also assigns a numeric, utilizing the key on the right, for each solution that results in a total score to prioritize those solutions. Note, there are 4 must-meet and 5 desired criteria. The must-meet criteria include 1. Effectively solves the problem. 2. Feasibility of implementation. Less feasibility is often associated with alternatives that depend on resources, departments, agencies, and stakeholders, etc., beyond the direct control of the organization or group. 3. Positive cost-benefit analysis. 4. Positive advantage-disadvantage analysis. Any ones in the must-meet category are disqualifiers. Desired criteria include 5. Politically acceptable, internally and externally to the organization. 6. Critically needed. 7. Is timely. 8. Is opportune. 9. Is financially acceptable. In this example, alternate solution number 3 would be the priority with a score of 39. My deputy and I used a decision matrix with tailored questions for our situation to prioritize the state health department's budget proposals to the governor and legislature. This was extremely helpful and often used by the legislature to prioritize and adjust their final budget and approved programs for the department as well. Steps 5, 6, and 7 are respectively select the best solution, implement, and evaluate. If steps 1, 2, 3, and 4 are done well, the selection of the best solution is relatively easy, utilizing the results of the decision matrix scoring of step 4. Implementation and evaluation planning relate to the organization's strategic plan and performance improvement process and are addressed in more detail in other sessions of the North Dakota Public Health Training Network. Key questions to address in implementation and evaluation include: who will be accountable? What will be done? How will it be done? And when will it be done? Evaluation is essential and often neglected by busy manager leaders who just assume the solution will be effective. With that assumption, they often move on to solve other problems and fail to assure adequate evaluation of the implemented solution. In almost every instance, solutions are less than perfect and sometimes, believe it or not, are not effective at all. Effectiveness of implemented solutions will only be known when appropriately evaluated. What isn't evaluated is never improved. High-performance organizations evaluate their programs and are brutally honest about the results. They use those results to improve organizational effectiveness. Low-performance organizations don't do that. The management style we've been focusing on is based on Western culture, where organizational structures are hierarchical, with many, if not most, decisions being made by individual managers. That approach may not work well in all cultures. We live in a global community, manifesting various cultural beliefs and values that impact organizational management. Let's consider a few of those cultural issues that relate to managing, including life orientations, appeals to change, and cultural aspects of decision making. Reisman years ago described 3 different orientations to life: tradition-directed, inner-directed, and other-directed. The outlook of tradition-oriented societies is, we always do it this way. The principal and primary goal is tradition and maintaining the status quo. These societies rely on structures that resist change. Decisions are made by the group through a more formal group process seeking consensus. Apollonian cultures, represented by traditional southwestern Pueblo tribes, practice extreme traditionalism and express great distrust of individualism. Individual decisions are thought to be too risky and tentative. These cultures may resist a Western leader-manager style. These societies follow clan and cultural heroes. Effective media to impact behaviors would include stories, myths, or true accounts of cultural heroes. The focus is on legacy, or remembering the forefathers, and on social harmony, not self-actualization. Let's now consider inner-directed objective cultures. Hesselgrave further subdivides Reisman's inner-directed orientations into objective and subjective. The outlook in inner-directed objective cultures is that something should be done because it's just the right thing to do. It's the law. It's written down. Conscience rules. The main goal is to expand frontiers, discover, adjust, and improve the world. Strong individuals decide in this orientation, and people are expected to follow through on their decisions. Tentativeness is not a virtue, but a flaw. They follow pioneers and visionaries. The strong Western leader management style fits well with this life orientation. Effective media for this group includes sermons or moving speeches by lawmakers and prophets based on absolute truths. Preach the truth that does not change, and let the chips fall where they may. There is a black and white in this orientation, and little room for gray. There is no compromise with the truth. The focus is on me, the individual, and self-improvement. This is consistent with Abraham Maslow's self-actualization theory. The inner-directed subjective orientation still focuses on me and individual decisions, but has an Eastern mysticism element to it. The outlook is follow the gleam or revelation. Give attention to the inner self and find yourself in your identity. Models include successful businessmen and gurus. The philosophical and religious visionaries and successful businessmen obviously have special supernatural insights. It is this special supernatural insight that allows them to be individually successful. This life orientation also supports the Western strong manager-leader management model. Effective media to impact this group is quite different from the objective individualist and includes the arts, poetry, and reports of visions and success. The other directed life orientation likely describes the gradual transition in Western cultures over the past several decades to the present. The guiding principle is contemporaries or peers and situational ethics. The outlook is it's okay if everyone else is doing it. The goal is to blend or adjust within society. Group decisions are common, yet these decisions are subject to change of mood and fashion. Group decisions in this orientation are more informal versus the tradition-directed orientation. The Western hierarchical management leader model may not fit this orientation well. Models are peers, music idols, actors, actresses, star athletes, etc. Effective media often focuses on messages and programs that help a person adapt and fit in, and may include things like counseling. The focus is on we, which is an interesting return toward the collectivity of the tradition-directed orientation of life. Associated with these various life orientations are 5 basic appeals to change, including to self, to social harmony, to authority, to reason and logic, and to shame and guilt. The to self and to authority appeals fit well with both inner-directed life orientations that focus on me or individualism. The reason and logic appeal may work best with the inner-directed objective orientation, where social harmony would likely be more effective with the tradition-directed and other-directed life orientations. There are also shame and guilt cultures. In shame cultures, one only experiences shame when caught. In guilt cultures, one experiences guilt when violating their conscience, whether caught or not. This latter is a common attribute of inner-directed, particularly the inner-directed objective orientation. Appealing to conscience in shame cultures would not be very effective versus guilt cultures. In shame cultures, a manager may need a robust monitoring system in place. We've talked about the various decision makers as related to life orientations. Let's now consider cultural decisiveness. All cultures generally lean toward either being decisive or indecisive. Some cultures place great value on decisiveness, and others on the ability to live with a degree of indecision. Western cultures generally favor decisiveness. Making any decision is better than no decision. Deliberations are expected to end in a decision or closure. Indecisiveness is considered a character flaw, evidence of someone not having the strength of character to commit one way or another. Decisions in Western cultures are considered binding. Many Eastern cultures are indecisive. When options are not clear-cut, it's better to make no decision rather than risk being wrong. Decisions in these cultures may be put off as long as possible. Deliberations in Eastern cultures often end without closure. Tentativeness is considered a sign of true wisdom. Decisions are not binding as in Western cultures. As you can imagine, clashes often occur between decisive and indecisive cultures. To an Easterner, decision cultures are brash and foolish, quickly making decisions without knowing all the facts. To Westerners, indecisive cultures are often considered of poor character or deceptive, since they either refuse to make decisions or change their decisions. Understanding and applying these cultural concepts of life orientations, appeals to change, and cultural aspects of decision-making are important for manager leaders, particularly those working in cross-cultural situations. In summary, the 5 management functions provide a solid base for managing an organization. Staffing is one of the more important management functions of a manager leader. Casting appropriate vision is essential for effective directing of an organization. Effectively applying the 7 problem-solving decision-making steps positively impacts all 5 management functions. Consider cross-cultural concepts when managing in a cross-cultural situation.
Take your public health practice skills to the next level. Our specialized certificate courses give you an opportunity to work systematically through a public health topic and demonstrate your understanding of that material in a capstone project. Learn more and sign up at ndphtn.com/certificates.